A very warm welcome to our chief guest, Dr. L. Hanumanthaiah, who has graciously accepted to speak on this extremely important public health issue. Dr. Hanumanthaiah is a member of the Rajya Sabha and a member of the Parliamentary Committee on Health and Family Welfare. He is also a member of the governing body of the Indian Council of Medical Research. Dr. Hanumanthaiah is also a noted poet and the recipient of several literary prizes, including the Sahitya Academy Honorary Award for Lifetime Achievement in Literature. It's an honor to have you, sir, and a very, very warm welcome. Thank you so much for coming.
Honorable guests of the day, Dr. Mishraji, Srimati Shailaja Chandra, and all other distinguished guests for the public health issue which has been taken up by this organization is very, very important. Lung diseases in the post-COVID era challenges for India is the subject to be discussed now. As already said, I am not a medical doctor. I am doctor by literature. But I'm working in health committee for the last 2 terms of the parliament. So I have a lot of issues which has come up in front of the parliamentary committee, particularly during the COVID pandemic. The other major concern which we were dealing in the parliamentary committee is the affordability of cancer, which is widely spreading across the country. As for my information, it is about 12 to 13 lakh patients every year adding to the cancer infection. And the death of cancer is almost 4 to 5 lakhs a year. That is also a serious issue. Treating the disease, according to me, the more important is to stop the disease or to find out before it infect anybody. And afterwards think of treating those who cannot find out before the disease comes. So there are many issues which are causing these kind of communicable diseases. Particularly cancer is one such thing which is going on. And after COVID, lot of young people are being attacked by heart diseases. Lot of young people. At the age of 30 to 45, and even 25 to 45, the report is that the COVID, whether it is a vaccine or the COVID bacteria which is affected them, or is there any other reason, the research is still going on, but we are not in a position to find out what is the reason. That is what we have discussed last. The Indian Council for Medical Research, ICMR, the committee has also requested them to go into the details of that kind of unusual heart attacks to the youngsters of the country, across the country. The reasons are not yet known, and the research and the data collection is also going on. That is one thing. With regard to cancer, tobacco is the main issue, which is a willful practice among the Indian people. Whatever you say, whatever campaign you make, that tobacco is injurious, smoking is injurious, alcohol is injurious, we are not able to stop those practices. And people are being attacked into that. Likewise, the lung disease also, as per the public health system, it is spreading across the country. It is due to modernization and urbanization are the main reasons which we cannot stop. Across the world, urbanization is the regular process. I think in India, the people are urbanizing for so many reasons. One is their livelihood. Second, the employment opportunity in the urban areas. Third, there is no atmosphere in the villages that they can live peacefully. These are all the three important things which I have observed. So for which we have not planned all our cities, whether it is Delhi or Bengaluru or any other city across the country, though we call it as a very planned city like New Delhi, but if you go to old Delhi, you cannot say the same thing that this is a planned city. In Bengaluru also, it was once upon a time called as a garden city. Now it has become on many factors, garbage city, concrete city. And traffic has increased so much. For the available roads in most of the cities, and the traffic which we are facing today is almost 5 to 10 times more than what the roads capacity is there. That is one part of the problem. The other problem is the environmental issues have come up recently, and we have been observing and we have been studying those things, those environmental issues, in which health is the major issue. See, the first point is you must eradicate poverty was the priority long back in a public domain. But now, allow them to live peacefully is a very important issue. Allow the human beings on their own earning, allow them to live peacefully. That is not there. That part of the thing which is affecting the health of the people is the major concern. In that, lung disease is the recent public issue in the country. So in most of our meeting, whether it is cancer issue, whether it is other communicable diseases, I have demanded a health checkup across the country to all the people, which has not, but time to time we get different kinds of diseases and different kinds of environmental issues. And today, I think for the last 2 decades, at least climate change has become an important issue across the world. Even to the climate change, the initiatives taken, particularly in a country like India where we have 140 million population, is not sufficient. That is what the expert says. It is not sufficient. We are not able to control the public transport. On one side, we encourage all companies to grow and flourish, like car companies, automobile companies, and we want employment. The other side, we say we want employment, so these companies has to come up. In fact, I must tell you, the states are in competition to invite investments to their states. For the simple reason, they want investment, their employment generation has to reach the people. That is their concern. On the other hand, the states never ever thinks what are the environmental issues due to this kind of industrialization. See, there was a time, if you don't industrialize any country, you cannot survive. That was the idea. But today, the cities have become most intolerable. And it is not only city, even the rural areas where the agriculture is their primary job, their living has become intolerable. Living is not that easy or that safe. So we have to take a holistic approach to environmental problems, health issues, and you just cannot take a single line. Say lung disease, the only concern today, and we have to work on that. That is not the issue according to me. You have to have a health checkup to all the citizens of the country, whether he has a cancer, whether he has a lung problem, whether he has other habits. Due to other habits, he has been succumbed into so many other health diseases. That holistic approach has to be taken up. And to stop the health issues or to reduce the health issues, the other issues, as earlier speaker explained to us, see, agriculture, they have no alternative other than burning. And we have to have a research on those kind of things, how to solve the problems of the farmers. So today we may discuss lung disease is a health issue. No, it is an issue which concerns the environment of the country, environment of the people again. And health alone cannot be dealt separately. See, unless you encourage public transport, the environmental problem will not be solved. Unless you take up agriculture issues and make farmers more environmental friendly, your health issues will not be solved. So there is a holistic approach to the whole problem. See, for example, air pollution. We say lung diseases due to air pollution. I must tell you, whenever I come to Delhi, it will be very difficult for me to breathe normally. I am finding it very difficult. But in Bangalore, I have no other issues. I will be normal. So it is not my problem, it is the problem of so many people who are coming across the country to the capital. So what is to be done? Okay, Delhi alone cannot be cleaned. The air pollution of Delhi cannot be cleaned separately. It is linked with the other cities around Delhi. It is linked with the states of other states of Delhi surrounding the Delhi capital. So it is ultimately the problem of the country and problem of the world. See, there are countries where the population is less and communicable diseases are less. But I must tell you another interesting thing. During COVID, the deaths in India are less comparable to Europe and other countries like US and other countries. So what is this? Scientifically, they are more forward and highly research is going on there. Highly moderate medicines are available in these countries, but the deaths are more. We were lacking even for an oximeter. The access to oximeter in many villages were not there. They used to travel 15 to 20 kilometers to check by an oximeter. In such a country, the deaths was very less. I am talking comparatively. Probably the reason being the immunity of Indians. It is not any medicine for that matter. But even during the COVID, we have to think now. Tomorrow we don't know what kind of diseases will emerge. What kind of bacteria will come into public space due to these environmental issues. So my point is, we have to have a forethinking, control the environmental issues right now, along with the health hazards. So my serious concern today, the government has to take up a holistic approach to the whole health issues environmental issues, climate change, and also the public health of the people of this country. I am always worried about one thing. Whenever these kinds of things happens, the most vulnerable sections are the urban poor and the rural poor. Of course, rural poor need not be used now. Almost all in the rural areas are vulnerable to these kind of hazards. So, it is the necessity today. It is not only just taking up lung disease separately or single-handed. It should be a holistic approach to health issues. And I feel we all must demand. I always in my meetings of parliamentary committee demanded for a regular health checkup. Before finding out this, so many lakhs have got cancer, so many lakhs have got lung diseases, so many percentage has been attacked with so many communicable diseases. Before telling that, let us have a holistic health checkup and see that their lifespan has to be increased if it is not stopped, so that they should have a peaceful life during their stay in the world, whoever it is. So I seriously think this kind of organizations, wherever it is, in which part of the country, which part of the world, doesn't matter. Taking up these kind of issues is signaling the society, signaling the governments that what is to be done. We will always think once we have been entered into a serious disease, then we will wake up and take up issues. But that is not the way. It is fine that I appreciate for that these kind of organizations has to signal the society and the government that this is the danger tomorrow and we have to wake up today and take an alarming call to solve the issue. In that perspective, I think the lung diseases challenges today is a wonderful initiative. I think a lot of doctors and experts are participating into this, and I am happy that I have been part of this initiative, and I wish them all the success in this endeavor. And I also request the experts to give fruitful suggestions to the government and health department of the country, so that I personally assure you, whatever you recommend and the experts recommend, I will definitely take it up in the health committee and demand the government that what are the initiatives that they have to take up further for a long run. So that is what I can issue. Thank you for making me a part of this initiative. Thank you very much.